No, I won't take the vaccine.
I am not convinced.
Because of the usage of the natural herbs and the natural remedy which we have here locally, I didn't see the need for me to take the vaccine.
I'm not sure I'll ever take this vaccine, and I'll not encourage someone also to take the vaccine because I'm scared.
These are among the 2/3 of Ghanaians who say they will not take a vaccine when offered one, as captured in a survey. Vaccine hesitancy has been identified as one of the top 10 threats to global health by the World Health Organization. Ghana became the first country globally to receive a vaccine shipment from the COVAX facility, a global initiative that is trying to ensure equitable access to COVID-19 vaccines, when 600,000 Oxford AstraZeneca vaccine doses were delivered in February 2021. The country also received a total of about 360,000 doses from India and telecom giant MTN as donations. However, vaccine hesitancy among Ghanaians is a huge concern for the country's COVID-19 vaccination rollout, already bedeviled by the delayed arrival of vaccine shipments. Media reports say some 2,000 vaccines deployed to the country's northern region expired due to low turnout. As of June 2021, less than 3% of Ghana's 30 million people have rolled up their sleeves to receive the COVID-19 jab. Ernesto Yeboah leads the Economic Fighters League, a movement of young Ghanaians fighting for economic democracy. He has not taken the COVID-19 jab and has misgivings about how the vaccines were produced.
In the wake of the pandemic, when people were talking about cure, the world kept, or the media kept infusing or injecting the idea of vaccine. So we say cure, you say vaccine. All of these has also created that kind of suspicion in the public domain regarding the taking of these vaccines.
Vaccine hesitancy is not new in Ghana.
A lot of people are confused. The youth are agitating and massing up for demonstration. Mr. Speaker, at this time of our country's development, we will not want to see social unrest due to negligence in educating the public.
Mr. Speaker, MPs from the region have been inundated with phone calls from panic-stricken constituents who believe that this trial is aimed at spreading the dreaded Ebola disease in the Volta region.
Systems that have been put in place to enable such research to be conducted in this country are not good enough.
Ghana Academy of Arts and Sciences are on our side. They have also raised concerns. Indeed, they met the minister on June 10th and raised 9 issues of concern.
We shouldn't suspend it. It should be stopped. Not in Ghana here. It should be done somewhere else. If they want to do it in Ghana, they should do it in the laboratories with mice, rats, and chimpanzees, but not with human beings. We would urge the Minister for Health and all those responsible for admitting or permitting this trial to take place here to reconsider, not just to suspend it, but to say no, thank you.
In 2015, the Ebola vaccine trials by pharmaceutical companies Johnson & Johnson and GlaxoSmithKline in Ghana's Volta regional town of Hohoe failed to materialize after residents agitated that they were being used as guinea pigs. Today, I am back in Hohoe to peel back the layers of time to understand how that whole episode has heightened hesitancy towards COVID-19 vaccination.
I think that this medicine or this vaccine is not good for us.
The problem at that time was it's like why Hohoe? right down the whole country. Why Kokwe? In the first place, we don't know the efficacy of that medicine. And we are afraid over here. It's like, why don't you try it on the whites? And then coming down to the blacks, and even blacks to Kokwe, when we have Accra and others, Kumasi, and so forth are there. So Ebola, we feel they are just coming to run off Kokwe Township, and then we die like fowls, like guinea fowls.
When this Ebola vaccine enrollment was about, or the trial wanted to start, they made a lot of promise to people. They will give you an amount of money, provision, mobile phone. Actually, there was no record of Ebola here. So imagine coming just to tell me that you want to come and give me a medication of HIV/AIDS, whilst I know I don't have AIDS. I won't be ready to take those medications. So that was what didn't convince us enough also.
Immunologists at the country's Noguchi Memorial Institute for Medical Research, Dr. Asamoah Kusi, says the 2015 botched Ebola vaccine trial has been a major setback for the country.
When these COVID vaccines came up, I'm sure manufacturers approached certain countries to do trials. We were never approached by any pharmaceutical industry because of what happened then. Because at that time, they had already invested a lot of money to get the trials started. And then that happened and it had to be stopped. And that pushes away, funders or sponsors for these things. Because you can't invest money only for a few people's reasons like that to just cut everything short.
Even though mass COVID-19 vaccination is yet to take place across the country, several concerns have fueled hesitancy in Hohoi.
It causes irrational dysfunctioning, like their minds can't perform well. And some even say the vaccine makes them grow old. I would say with the reasons from my house and my household, we decide not to partake in the enrollment.
Like a man taking this vaccine, you cannot or you may not perform well in bed with your wife or your girlfriends. And even the women are afraid. My family, in fact, we are not interested in taking it. These whites, they are very smart. You don't know the strategy they are putting across. And if you don't take them, they will just kill all of us, the blacks.
To disabuse the country of some of these myths and misconceptions, President Akufo-Addo and his wife were the first in Ghana to take the jab live on national television.
Taking the vaccine will not alter your DNA. It will not embed a tracking device in your body. Neither will it cause infertility in women or in men. As your president, I want to assure you that the vaccine is safe.
But these residents are not convinced.
Nana Akufo-Addo is not David. He knows why he's taking it. And why I said I will not take it, I know. What of if it comes to reality that what he has taken is different from what they are giving me.
You don't expect a same vaccine given to a president to be given to me. What if the one at my end is being changed? How do I know?
The reasons people choose not to vaccinate are indeed complex. More than 150 kilometers away from Hohoi to Ghana's capital Accra, a lecturer and senior research fellow at the Institute of African Studies at the University of Ghana, Dr. Obadali Kambong, is on a crusade against vaccination. He believes it is an agenda to wipe out the black race. Dr. Kambong references a 2007 book by renowned American writer Harriet A. Washington titled Medical Apartheid.
When I see continental Africans or diasporan Africans who are a bit reticent at, taking the vaccine due to concerns of imperialism, for me it's not surprising at all. Even those who may not have read about all these different cases that I'm citing here, again, very well documented. There is at least oral histories where someone can say, oh, in my family they did this. There's also a record of what's called eugenics. You can find that in the same text, but then also there's a documentary called Ma'afa 21, where it goes into Margaret Louise Sanger, the founder of Planned Parenthood, and Marie Stopes, that all of them were eugenicists. And their stated intention was to exterminate the black race. So they made sure that the clinics for family planning were always going to be in the black neighborhoods. Meanwhile, the fertility clinics were going to be in the white neighborhoods, surprise, surprise. So all of these things, we can go, into also experimental surgical procedures that were done. If you look at the role of a doctor named Sims, and he is regarded as the founder of gynecology, what he did, he would take enslaved women and he would rip their vaginas apart and then suture them back together. Rip their vaginas apart and then suture them back together until he found himself to have this cure for fistula.
Dr. Kambong reveals he and his family have never taken a vaccine and they never will.
What we use when we travel is an actual affidavit. So we deal with different protocols at the UN level, World Health Organization level, so forth, that declare that a human being has a right in order to refuse vaccination. So what we do is that we actually take that in order to travel. So when we're going to another country, we show that it's documented, it has all of the, official standing, and that's how we move. You understand? So one is because we are quite aware of the effects of vaccines. You see, various cases of vaccines. I actually have a friend here in Ghana who can barely walk, right? He has to hobble along, and it comes from a vaccine that was administered, shortly after birth. So these are not isolated cases, that you have very well documented cases of the damage, both neurological damage, physical damage that vaccines have done. But again, usually even in the development of the vaccines in the first place, it's black people who used as guinea pigs, right? And then beyond that, we tend to be the ones who suffer the worst effects, from these types of trials.
His wife, Carla Kambong, backs her husband's assertions.
There are natural ways that you can heal yourself from most of the diseases that people have to take vaccinations for. I have 3 children. They've never been vaccinated. My husband as well. My husband's family. So being that that's the case, I know with present day examples that it doesn't help.
The issue of vaccine hesitancy has resonance across the African continent. Afrobarometer surveys in 5 West African countries, Benin, Liberia, Niger, Senegal and Togo, between October 2020 and January 2021 show that only a minority of citizens want to be vaccinated and that most do not trust their governments to make sure the vaccines are safe. In some countries, most people prefer to rely on prayer. Foreign medicines, especially vaccines, have been met with suspicion and hostility in Ghana since the 19th century British colonial rule and still persist more than 6 decades after the country attained independence in 1957. Political historian Professor Nana Esilfi Kondua reckons the resistance stems from an age-old distrust.
There was great belief that the jab has side effects which are no good, making you maimed in the leg or in the foot or by the waist or by the part of the back. And so there was that also suspicion competing. It ran through to poliomyelitis. So that belief continued to exist. Our medical structures have not been able to banish it altogether.
Central to this is where the line should be drawn between a government's duty to protect the health and safety of the citizenry and the individual's right to bodily integrity, particularly when a worldwide pandemic is causing millions of deaths and economic devastation. So, if persuasion to receive vaccines fails to achieve a safe level of public immunity, will Ghana's government explore the option of mandatory vaccination? Dr. Anthony Insiasare is Presidential Advisor on Health.
Yes, we still believe that there should be mandatory vaccination.
But is this even ethically defensible? Dr. Divine Indombi Banyobala is a medical legal expert.
Mandatory vaccination, no matter how well intentioned, is not something that may be ethically defensible. And it's not something that because you have to look at first whether there is the risk that the person presents to the general society, whether the action of mandatory vaccination is proportionate to deal with the risks, whether there are not any other alternatives that are less risky. For example, it's not everybody who may qualify to take the vaccine. You may have some specific allergies to the constituent elements of the vaccine, and therefore, if you are known to have that, you will be excluded from taking the vaccine.
Perhaps in resolving this dilemma, much may hinge on what is understood as mandatory.
We don't force anybody to take anything against the will, but we convince you to take the vaccine. That is what we are doing. We are not forcing anybody. If you want to force anybody, then anybody who is passing, you tell the person to go for the vaccine or you don't pass it. But you can also make sure that you use that one also to make sure that you don't, somebody who doesn't want to take it for one reason or the other, doesn't infect the other neighbors. In some other countries, they won't force you, but they will tell you that if you will not take the vaccine, and you are working, for example, in my office, every week, go and do a test and come at your own cost. Come and show to us that you are negative. If you can do that. And I don't know why people don't want to take the vaccine. In fact, nobody has convinced me why the vaccine is dangerous.
So, can the race towards public immunity wait until every citizen is fully convinced about the safety of the vaccine? Immunologist Dr. Asamoah Kusi believes Ghana is far from achieving herd immunity.
The challenges are many. One, hesitancy as you talk about, but two, the fact that we can't even get the vaccines to buy. Now, the concept of herd immunity as of now, if you can achieve that even, goes with vaccinating anything from about 65 to 80% of your population. We are nowhere near even 3%. So we are nowhere near herd immunity. And when I hear people talk about, oh, we will achieve herd immunity, we are so far away from it.
Dr. Anthony Insiasare disagrees. He insists government's plan to vaccinate 20 million residents, about 2/3 of Ghana's population, by the end of the year is still on course.
The target was to vaccinate about 20 million Ghanaians by the end of the year. So that is the target that we are working towards. We will step up our vaccination and get the necessary vaccines to vaccinate the 20 million Ghanaians in the third and the fourth quarter of this year. And we can achieve the target. I'm very, very hopeful about that.
Hello. As you're all aware, the FDA has given authorization for the use of some vaccines in Ghana.
Earlier this year, the country's Food and Drugs Authority, the Ghana Health Service and its partners began campaigns to fight misinformation concerning the safety of vaccinations and conspiracy theories. But it appears the issue is more complex than meets the eye.
The paracetamol that you take, where did it originate from? Has paracetamol killed us? No. The anti-malarials that you take, who manufactures the anti-malarials? Have we been stimulated? No. The vaccines our children are taking, where does it come from? So these are some of the things you should put in place. And I know, and I believe very much in immunization or vaccination.
Have you heard of Project Coast? Have you heard of SAMAR and how they established AIDS clinics for the express purpose of injecting black people with AIDS with the view that this would exterminate the entire black population of South Africa? Are they aware of the Tuskegee syphilis study? Are they aware of the tests like in Carver Village where they, sent out these mosquitoes on the unsuspecting black population, causing generations and generations of debilitating effects? Are they aware of, and we could just go down the list of hundreds and hundreds of things, and I would highly doubt that even the most famous one is probably the Tuskegee syphilis experiment, right? But I would highly doubt that they've even heard of that. So how can you have Nyansa without having the experience, without knowing about the documentation of all these other cases where vaccines were introduced specifically, and in other cases of medical abuses, a long and sordid history of medical abuses at the hands of the exact same people who are now bringing vaccines?
It's most important that we endeavor collectively to let our people understand that there are very dangerous implications about not taking the vaccine.
It is in our collective interest that we all get this done, so that for those who genuinely cannot be vaccinated, we protect them as well.
Africa, we have only 1% production of the total vaccines that we are relying on. And one of the reasons why we are not able to take care of ourselves now is because we are relying on imports. And we think that everybody should support the president's drive to have us invest in local science, health-related research, into local medical training, so that we can have medical doctors who will go into molecular biology, into genetics, into immunopathology, and those areas.
Experts say there is an urgent need to recognize the importance of distrust in vaccination campaigns. Research has shown that immunization is one of the most cost-effective public health interventions. The World Health Organization estimates that vaccination prevents 2 to 3 million deaths each year. The UN agency recommends that the benefits of vaccines should be communicated better, while myths and misunderstandings must be addressed. It further says raising awareness is unlikely to be enough unless people trust those providing the information and delivering the vaccination services. In a world where the global rollout of vaccines is considered crucial in bringing the deadly COVID-19 to an end, boosting immunization seems more important than ever.
Please, look, please.
Ridwan Karim Dini Osman, reporting for GH1 News.